Welcome to the first Ardenwood Presents webinar of 2023, focused on Medicare for Christian Scientists. I'm John Mitchell, and I serve as Executive Director and CEO for Ardenwood here in San Francisco. Actually, I'm currently on the road, being graciously hosted in a beautiful home. Our webinars are designed to inspire and inform you about topics that are important for all of us to be aware of. Today, our presenters, Jim, Katie, and Leslie, will provide an update on Medicare plans that best serve Christian Scientists, and then answer your questions. As a 501c3 charitable nonprofit organization, Ardenwood supports the ministry of Christian Science nursing. It provides a place to receive skilled Christian Science nursing care and to experience healing. It reaches out in service to the field through our visiting Christian Science nursing service, Christian Science nurses education and training, and online events like this one. Your support helps us provide the highest quality of uninterrupted care and outreach. You are invaluable to Ardenwood. And I also want to thank those who financially support these events. It's a real help, so we thank you. Now, let's talk about today's webinar topic, understanding Medicare as it relates to a Christian Scientist. You might well ask, why Ardenwood is promoting Medicare? Well, we're not. Medicare is simply one option for those who are 65 or over because they have all paid into Medicare throughout our working lives. Here's a very important thing to know. There is no difference in the care you receive at Ardenwood if you are on Medicare or not. Medicare simply comes into play when you pay your bill. I do want to emphasize the wisdom of giving thought to a care plan in the event of a need for Christian Science nursing care. I can't emphasize this enough. If you have such a need, you want to be focusing on God and on healing, not on how to pay for care. Thinking through your options in advance is a support to healing and to your families and loved ones. It's also support to those who care for you, and it's essential as it's for a reason to find yourself, if you do find yourself in a care setting that's not your first choice. Those things happen. Ardenwood is designated as a religious non-medical healthcare institution. I'll repeat that. A religious non-medical healthcare institution as related in the law. Also, the nickname is RINKY for short. As a RINKY, Ardenwood is a Medicare Part A provider. One perception of Medicare is that it wants too much information about your physical well-being. As the payor, just so you know, Medicare wants to ensure that the care received should be covered. In other words, your care needs would require a hospital setting if you weren't at Ardenwood or another Christian Science care facility that includes Medicare Part A. We have found at Ardenwood that Medicare is much less intrusive than most insurance companies. As you know, Christian Science nurses do not diagnose, so we report only general information to Medicare. That's how the accommodation exists in the law. And finally, the content shared today is informational and is not intended to be legal advice. A replay of this webinar will be available on our website in the next day or so. Replays of all of our webinars are also on our website, ardenwood.org. As a reminder, you can ask questions using the Q&A button at the bottom of your screen. So now, let me introduce our presenters. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He is also a certified long-term care insurance strategist. Jim has talked to more than 1,500 Christian Scientists since our first webinar a few years ago, answering innumerable questions about Medicare, long-term care insurance, and estate planning. He's been a tremendous blessing to our field. And from what he's told me, he's loved meeting and working with all of you. We're grateful for Jim. Katie Burris is a Medicare specialist and certified long-term care consultant, helping individuals with their Medicare and long-term care planning strategies. Katie's a partner at McGrew & Maher Insurance Services and has been in the business for 18 years. She is licensed for life insurance, long-term care, and Medicare in several states. Lesleah Frisco is Ardenwood's Director of Christian Science Nurses Education and has extensive experience not only as a Christian Science nurse, but also with Medicare through her work here at Ardenwood. So let's get started. Jim, Katie, and Leslie, we're all set.
Thank you, John. It's always nice hearing from you and working, like you said, with all the Christian Scientists. I think we've been this maybe our fifth year or so, but it's just an absolute pleasure. And we deal with Christian Scientists all over the United States. Katie talks to probably as many as I do, and I'm thinking that 1,500 number may be low. Pretty soon we're going to have to bump that, but it really is. It's a pleasure. And we're going to go through some basics today that's really important for a lot of Christian Scientists. That we're in a certain Medicare period. There's so many different Medicare periods. How can you even know which one it is? But this one's going to pertain to a lot of Christian Scientists that have not enrolled for Medicare Part A or B, or they're thinking about it, not quite sure what to do. So we're going to go through this presentation, and we're happy to answer as many questions as you have. And our contact information will be at the end, so you can email us or call us anytime. We're happy to be of service.
Perfect. So a little bit about us. He is Jim Maher, and I am Katie Burris, and we are McGrew and Maher. We are brokers, consultants who specialize in Medicare and long-term care. We are not affiliated with Medicare, Social Security, or any other government agency. And our real goal is to help mitigate healthcare costs and risks in retirement. And you can see that is us and our staff right there on the right-hand side.
Yes.
So today's agenda, we are going to talk about Medicare basics, what Medicare covers, supplemental coverage, what's going on now, and then long-term care, and then we'll have a Q&A at the end as well. So for Medicare basics, we talk about the parts of Medicare. And original Medicare has two parts. Part A, which is the hospital insurance, or RINKI being a religious non-medical healthcare institution like Ardenwood. We just refer to it as RINKI for short.
Right.
Part B is the medical insurance side. So original Medicare, you'll see on the right-hand side, is that red, white, and blue card that you get from the government, and that's referred to as original Medicare.
It used to be simple, right? Only two parts. I mean, that really was A and B, and now they're going to add other parts, and you hear all these commercials on TVs talking about all these different plans. So we're going to try and straighten that out for you and try and make it simple for you. But original Medicare was started back in 1965, right? And there are two parts, the hospital side, and it's really amazing what they've done for Christian Scientists, how they've really said you can receive care in a non-medical facility. So that's like nothing else I've ever seen. So that's a good thing. And part B is, like Katie said, the medical side. If somebody had a tumble or a fall or a bone break and has to be reset, that would be covered under the Part B side of Medicare.
So to get Part A and Part B of Medicare, you have a few different times. One of them being the initial enrollment period, and that revolves around your 65th birthday. So what you're told is that Social Security tells you have 7 months to enroll. You have 3 months before your 65th birthday, the month you turn 65, and 3 months after. So you can enroll during that time and pick up A and B.
Which is really, that's a pretty big window. That's a 7-month window. But the problem is they don't tell you about it. The only way you really know is you get about 1,000 advertisements from every insurance company in the world out there wanting your business, reminding you that you should be on Medicare. So that's how it works. But it is a 7-month window. And if you miss it, one of the periods we're going to talk about today is how to fix that, right? If you mess it up, we're going to show you how to unmess it.
The second time, so if you don't do in that initial enrollment period, is a special enrollment period if you're working past 65. So we talk to Christian Scientists every single week that are turning 65 that are still working. And when you're covered on a group plan, you have 8 months after that group plan ends to enroll in Part A and Part B.
But nobody ever waits 8 months. Nobody does. We were just talking to somebody today. I mean, we had a 67 and a 72-year-old, and they're like, we're going to retire finally. Now, when do we start Medicare? Well, you don't want to wait 8 months. You normally want to do it at least 3 or 4 months in advance so we can do some planning to make sure everything's coordinated, that you're not going to be penalized because you've been covered by a group health plan. That's the key. The government looks at you, and if you don't do this, they're going to fine you. So today we're going to try and talk about how to avoid those fines. But group plans always provide protection for that.
And then you would have 2 months for parts C and D, and we'll talk about what those are.
Makes no sense. We don't know where 8 and 2 come from, but that's how the government figured that was easiest for everybody to understand, I guess. Okay.
So if you did not enroll during your initial enrollment period, and you didn't enroll if you didn't qualify for a special enrollment period, or maybe you worked until you were 68, 69, 70, and then you picked up Part A, but not Part B, now is the time of year when you could pick up Part A, Part B, or both if you need to. So it happens between January 1st through March 31st. And you would be able to enroll, but you may be subject to a late enrollment penalty.
And that's the number one question we get. How much? Gee, if I didn't sign up and it's been 2 years or 3 years, how much is it going to cost me? And that's something we talk to individuals about and see, is it right for you? Right? I mean, you absolutely need to think about it and pray about it and decide if that's in your best interest to do. But this is the time frame. So we've got till the last day of March if you want to add Part B. A lot of people after 70, most people are receiving Social Security benefits, so you have to have Part A of Medicare. So that's why we talk about normally just adding Part B only.
Last year, I know when we talked about the general enrollment period, it happened between from January 1st through March 31st, and coverage started July 1st. For 2023, that has changed. So if you applied in January, they made your coverage effective February 1st. For those of you that are just now hearing this presentation and thinking that you may want to apply, you have until March 31st, and they would make your Part A, Part B, or Part B, if it's just that, effective April 1st.
So just to recap, they did something good, right? They took that craziness of waiting away for 7 months. I don't know why. So the government did something good. So that's something new for 2023.
And then once you have A and B, you can decide if you want some sort of supplemental insurance coverage. And we did go over that it's now effective the 1st of the following.
Right. That's a big deal.
So what does Medicare Part A and Part B cover? We get that question a lot because some people just have A and B or just A, and they want to know how things work. So Part A, the hospital or the Rinky insurance, would cover Christian Scientists in a Rinky like Arden would, since they're certified to participate in Medicare. Part A is premium free if you or your spouse have worked and paid taxes for at least 10 years. So as long as you've paid into Social Security for 10 years, Medicare for 10 years.
And I'm going to say most people we see it's premium free, right? I'm going to say 99% of the people we see and talk to, it's premium free, meaning you don't have to pay anymore. You paid as you went, you paid a little bit as you went. That's why there's no future premiums on Part A.
You prepaid it.
You prepaid it, right? That's all you've done. You prepaid it.
Coverage is nationwide on Part A. So wherever you are in the US and territories, it covers you in any hospital or Rinky that participates in Medicare.
Right. Anywhere in the United States.
Anywhere.
So, and we just as a reminder, Canada and Mexico still are not part of the United States, because we have a lot of people like to travel and go, well, I'm going to Canada. Am I okay? And I'm going, well, that doesn't cover you in Canada, right? So you have, there's certain things on there you have to be aware of. But being in the United States or one of its territories, that's where Medicare works, not in Europe or Canada or Mexico.
So if you just have Part A has what's referred to as a benefit period. So a benefit period means the day that you're admitted as an inpatient in a Rinky or a hospital, and the benefit period ends when you haven't received any inpatient care for 60 days in a row.
Right. And this is not just that. So this is not calendar year. This is a benefit period. So if I'm in now and I wait 60 days and I go back in and whatever in the 90th day, it's going to start this all over again. I'm going to have to meet that Part A deductible and the copay per day. And we're going to share that with you in a minute here too.
So for a benefit period, when you are in a facility like a Rinky, for days 1 through 60, you would have a deductible of $1,600 that you would have to pay. Starting on day 61, if you're still in the rinky, then you would have to pay $400 a day. And if you're still in the rinky or a hospital, on day 91, your cost is now $800 a day, and you would have 60 days to use. They call them lifetime reserve days. So if you're in a rinky for 100 days, you've used days 91 through 100, so you've used 10 of those 60 lifetime days. Leslie, anything to add to that?
I think the other thing to consider is you don't automatically get the 60 days. We're expecting healing. So if one is only requiring skilled care for, let's say, 2 weeks, you might actually only use 14 days. And then you might get a notice that says, the good news is you're healed. The bad news is Medicare will no longer continue to cover you. So that's an assessment that's made at the facility based on the need for skilled care. So it's not an automatic, but but it's also a lovely benefit if you should need it for that length of time.
Right.
And that's one of the questions that I know I and myself and Jim both get most frequently, is knowing when it's covered by Medicare.
And it's on a case-by-case basis. It's not someone can not just say, I want to use my Medicare. There has to be a need for skilled care.
Mm-hmm. Thank you, Leslie. So the cost, if you were to be in a rinky for, let's say in this case, 150 days, you'd pay that $1,600 deductible. And then for the next 30 days, you'd pay $12,000. And then for the days 91 through 150, if you were still in a rinky and you still qualified for the Medicare level stay, would be another $48,000. So the total is a little bit over $61,000 that would come to.
That would be the worst case,
Yes.
right? Yeah. Okay. But we've got good news. We're going to show people how,
Yes.
if you don't want to worry about that, there are ways we're going to show you with some insurance products how you can not worry about that worst case scenario.
Correct.
And we're like you, Leslie. We hope that the spiritual healing is quick and you don't ever have to be faced with this scenario. But if it does happen, there's ways to protect yourself and your family.
So part B is the medical side. So some Christian Scientists have part B and some don't. Part B has a monthly premium. It ranges from $164.90 up to $560.50. So the reason for that difference is based on your income, because Medicare is Social Security. When they sign you up, they're going to look at your tax return and see 2 years prior and figure out where you fall.
Right. Not that they don't trust you, but they are going to look at your tax return and your modified adjusted gross income. So it's basically your adjusted gross income. And if you had like tax-free muni bond income, savings bond income, foreign income that's not really common to most people, but that's what modifies it to lift you up into another bracket so that you would pay more premium, unfortunately. Good news is, though, the premium went down this year.
It did.
Right? It was $170 and it actually went down. And the only reason it went down, not they're doing you a favor, is because we were overcharged the last year. That's the reason why they're trying to come back and do. They said their system couldn't handle making this effective like last July, so they waited until January. So at least it went down. That's good. It's a good thing.
And then same thing with Part A. Part B is also nationwide coverage for any provider that accepts Medicare. And the late enrollment penalty, we talked about that and we're going to mention it again and again, is that 10% for every 12 months that you should have had it and didn't. So if you go 3 years, you'd be looking at a 30% penalty on top of that premium.
Yes.
So Part B, there are instances where we see, like most common with Christian Scientists, are the items that have the asterisks. So we see like x-rays, if you need to have like a bone set, and then in some cases, when like an emergency happens, an ambulance and emergency room services, especially if something happens you're in an accident or something happens and you're unconscious and someone calls 911.
Right. And John always gives a great example about an example he's used in the past that happened to him. And the other thing is if somebody has a tumble, right, and they're taking you in an ambulance to a hospital, Leslie, we should probably talk about the Advanced Healthcare Directive also, correct? Is this a good place to do it, you think? Or
Be happy. That would be just great to do that.
Right, because if I'm taken there to the hospital against my wishes, but they don't know that's not my wishes, right? They don't know that.
And if you're not able to speak for yourself, so Advanced Healthcare Directive is something that everyone needs, everyone. It simply, you designate someone as an agent that can speak for you, that will present your wishes should someone ever need to, where you're not able to speak for yourself. So in this scenario of someone else calling 911 and you're in an ambulance, you arrive at the emergency room, they're going to do what they need to do. If someone can produce the Advanced Healthcare Directive, that will help notify the medical personnel what your choice of care is. It may state what you don't want them to do, what you do want them to do, but it gives another individual authority, and that really can come into play in getting released from a hospital setting if that's not where you choose to be. There has to be someone with authority to do that if they don't think you're able to make that decision for yourself at that moment. So it is absolutely essential, and to update it, keep it current, review it every year. You could scan it and have it in with you in your phone. Give the individuals that you've listed as agents, give them a copy of it. Be sure you know where your copy is. If you're thinking of this for a loved one, having it posted on the refrigerator is actually where EMTs will look. If they were ever called to the home, they know to look on the refrigerator for these documents. Who knew?
Yes.
But that is where they are. It's just, I think, especially a protection to a Christian Scientist who really may have some very strong thoughts on how they want to be cared for. So we do ask anyone that's being admitted to Ardenwood, either as a visiting Christian Science nurse patient or into the facility, we do ask that they have an Advanced Healthcare Directive. It is just, you never know when it might be needed, and it is very, very helpful document to protect you and your loved ones.
That's true. And Leslie, that's still, you have that on the Ardenwood website. Is that available?
Thank you, Jim. Yes, it is.
Yeah.
It is on the Ardenwood website. There is a copy. It is one that has been vetted by lawyers that are Christian Scientists within California. We do know other people in other states, other Christian Scientists have borrowed it. Just have your attorney review it and just make sure it will work in your state. There's nothing unique to California about it, but it does give you many options to state what your choices would be, whether it's life prolonging or resuscitating or different questions it will ask, and you can decide and designate that in advance. And the other one thing that I think is really important is to designate on it when you want it to come into effect. So personally, I have found it very helpful if you say it is effective now. You are designating someone you trust to be in that role. You know that they understand your choice, to give them the opportunity to be in that role without having to somehow prove that you're incapacitated and not able to make that decision. If you just give them that authority now, then it can avoid any challenges later on.
Right. No, those are great points, Leslie. The other thing too that we get is if I'm living in California and my daughter's in Washington, my son lives in Carmichael, and my other son lives in Florida, then you probably want to have maybe a local presence, right? Maybe that son that's living in Carmichael, California, for example, to be the primary on that. I would think.
It's helpful, but I don't know that it's absolutely necessary in this day and age. Because you can electronically transfer, and they can send the documents and then perhaps speak over the phone. Obviously, being a presence is helpful, but
okay.
And I should also mention, There's a few people that would not be wise to put there. You should not have your agent be a Christian Science practitioner or a Christian Science nurse that is involved in your care. It could be a family member, it could be a church friend, it could be a neighbor, someone who knows you well, but not someone who's in the role of providing care for you. That's a bit of a conflict of interest.
Yeah, that is so important, Leslie. Those are great points, really. Yeah, it really is. So I'm glad we brought that up. So, okay. Back to Part B of Medicare. Okay.
That's quite a diversion.
If you have a need for the Part B, the medical side, you do have for this year, for the calendar year of 2023, you have a deductible of $226. After you hit the deductible, you would be responsible for 20%. But the problem with that
is there's no cap. So it's easy to sit here and say, well, you only pay 20%, there's no cap, don't worry about it. Listen, I've seen some of these emergency room stays and some of these MRIs and CAT scans billed out at $10,000, $20,000, $30,000. I've seen outpatient surgeries billed at $70,000 for one day, right? I've seen that, and it's crazy. So paying 20% of something with no cap can get really expensive. So we're going to show you an alternative to that too, how you may want to decide if that's going to be best for you and your spouse, or to decide if a supplemental plan, which would cover all of that and make that no cap 20% go away.
Mm-hmm.
Right?
So original Medicare, that Part A and Part B, there are items that original Medicare doesn't cover. It doesn't cover all of your cost of care in full. So we know we talked about the deductibles, the co-pays, those amounts that you would have to pay in the hospital, or if you had some sort of medical emergency or something happened and you needed to use the medical side. It doesn't cover prescription drugs. It doesn't cover routine dental, vision, or hearing care.
Which is the number one question we get asked all the time. What about dental and what about vision? Right after Medicare, it's what about dental and vision? And it's interesting that it's not covered, right? And there's reasons for that, but ultimately it should be covered. And I wish it was covered. It would make everybody's life so much easier.
So Medicare does not cover long-term care. It's also referred to as custodial care. So we always talk about those activities of daily living, bathing, eating, dressing, stuff like that. And it also does not cover care received outside of the United States, only in the US.
Right.
It also does not cover the cost of a Christian Science practitioner. That is
That's
completely
good.
separate, private pay.
So that is a private pay if they come in under there. Okay, that's important to know.
There are some funds available, but not through the government.
Okay.
So supplemental coverage options. The first thing is once you have Medicare A and B, that original Medicare, you can then decide if you want additional coverage or insurance on top of that. And you really have two different options. The first option is a Medicare supplement. They also refer to it as a Medigap plan. And then you can decide if you wanted prescription drug coverage, which is optional. And most Christian Scientists don't do that.
Right. Yes.
Jim, while you still have this slide up with the Medicare card, could you remind people about the old Medicare card versus the new one?
Oh, that's a good point,
Because
Leslie.
we're still seeing the old ones that people have had in their
Right.
wallets for years.
And that's a really good point. So if you have an old card, and you can tell because on the old cards, your Social Security number is plastered on the front, right? And then they put a letter after it to disguise it. So if you have an old Medicare card on there, you need to call 1-800-Medicare. It's real simple, 1-800-Medicare, and get a new card. These new cards have an 11-digit encrypted number on there, and that's your Medicare number for the rest of your life. And Leslie, that's so important because people, I've seen them come in the office where they're saying, well, I've got a couple of them. Which one do you need? I'm going, well, you need to destroy the old one. That's only going to get you into trouble. But they need to have the new card, Leslie. You're exactly right. Yes, so true.
That was mailed out a few years ago. It was mailed in waves over the period of a little over a year to the different states. But yes, you would want the one that definitely looks like that one there that has, that says the Medicare health insurance. And like Jim says, has that 11-digit number.
Right. And so now we're going to talk a little more about Medicare supplement, Because this is going to take away all the liability, right? If I have to go in for an extended stay, or if I have a bone that needs to be reset, things like that. So in order, like Katie said, they don't make it simple. I like calling it Medicare supplement. Some people call it Medigap. It supplements and it covers all the gaps or co-pays, deductible, and Medicare. So again, you've got to have both parts A and B. And it's going to help say pay some of the costs not covered by Medicare. For example, like that 20%, right? I don't want to worry about 20%. So if I get some type of Medicare supplement plan, I'm not going to worry about that.
And we're going to go over that.
Right. And we're just going to, I'd rather pay an insurance company a few dollars and say, I'm just not going to worry about that.
The plans are offered through private insurance companies, so not through the government. You buy them through the insurance companies, and they can help limit your costs in a rinky if a medical event happens, anything like that, and nationwide coverage. And there's no provider network. So any provider that takes Medicare, that red, white, and blue card, they would also take the Medicare supplement plan as well.
It's so simple, right? No more lists, and people on group plans are used to PPO and HMO and POS and HSA and all this stuff. Original Medicare is just so simple. The physician or whoever the practitioner, if they take Medicare, you're in. It's that easy. It really is. It makes your life easy.
They call them guaranteed renewable, meaning the insurance company can't pick on you because you have a claim. So
Right.
if you've used this, let's say if you've had to be in a rinky a couple times in a year and their Medicare stays, the insurance company can't come after you and say, well, you've used that plan a couple times, we're not going to renew your insurance. As long as you pay the premium, they continue to renew that plan.
Right. And we see that a lot. Actually, that's a pretty frequently asked question too, is can they cancel me? And the answer is no. You just got to make sure you're paying your premium. And the policies are contracts, meaning guaranteed renewable. So you're always going to have that coverage. People always sometimes like, well, I'm in my 80s. Do you think I really need that? Now I'm like, yes. You know, you paid on it for a long time. Now it's not prudent to probably drop that. So you definitely want to hang on to it.
With the supplement plans, instead of saying we're going to have plan red, plan yellow, something like that,
Right.
they decided, the insurance companies decided, let's
Hey.
go ahead and do A, B, C, D, because that won't be confusing
Right.
at all.
Yes. But-
So they are plans, not parts. So parts are going to be through the government. Plans are going to be the insurance options.
And we're going to make it easy for you. We're going to show you this is the most popular plan right now. As a matter of fact, this is the plan I have. And I have Plan G, and I absolutely love it. It makes my life easy. I don't worry about bills. I worry about a small deductible this year, $226. After that, doesn't matter, I'm covered at 100% wherever I go. So it makes life easy. Plan F used to be the most popular one right next to it. But Plan F's only available to somebody if you were 65. Well, you had to be born in 1954 or earlier to get that. But Plan G is awesome. It's great. It's peace of mind, and it's easy. And we're going to show you how you can get that if that's what you so choose.
So we talked about the Part A costs, like if you're in a rinky or a hospital. If you have the supplement, then like supplement Plan G, that would cover the entire stay. So you don't have to worry about the co-pays, that $400 a day or the $800 a day or anything like that. They would cover you up to a 365-day stay.
And that's zero. That's easy for me to pay because it's zero, right? You don't have to worry about anything.
Jim will cover your hospital
It's
costs.
zero. It makes life easy.
On the medical side, so when you just have Part B and you don't have insurance, we know you have to pay that deductible, and then you would have to pay 20%. If you have that Medicare supplement Plan G, it takes away that 20%.
It disappeared, right? So my liability this year, since I turned 65 last year, is $226. That's it for my entire Medicare medical costs, anything Medicare approves. I'm in at $226. And the amount that I'm paying out here is, I'm almost afraid to say how reasonable it is, but it's incredibly reasonable to protect my family, my wife, my assets for a $226 deductible exposure. That's it.
So Part D, so we talked about if you get the supplement, you can do optional prescription drug coverage. So Part D, it helps with the cost of prescription drugs, and coverage is optional.
Right.
If you don't purchase it when you start Medicare A and B, there may be a penalty if you purchase it later.
Oh, there's gonna be, right? They think that you can, no, they're gonna
Yeah,
catch
they
you
are.
sooner or later if somebody enrolls for it. And we're gonna talk about that, right, with the Medicare Advantage plans in a minute?
Yeah.
Yeah, okay, good, okay.
Plans are offered by private insurance companies, and there's two ways to get coverage. So when we were talking about original Medicare and we talked about the supplement, you can also add a standalone prescription drug plan if you wanted to. Again, you don't have to. If you get a Medicare Advantage plan, most of the time the prescription drug plan is built into that. So you can't decide not to get it on that.
Right. And then you get a surprise pretty soon. So if I'm 70 and I get one of those Medicare Advantage plans that Joe Namath's advertising on TV, or Jimmy J.J. Walker, or whoever's telling you how great and cheap they are, and they go, well, you can get this plan for $0. And all of a sudden I get a notice, right, coming from the government saying, guess what? You haven't had drug coverage for 5 years.
We're going to talk about
I know we are, I know, but I just get excited. I just want to forewarn people, but we are going to talk about that. Right? They think it's not going to catch up with them, and then it just does.
So late enrollment penalties. Part A doesn't have a late enrollment penalty if you qualify for Part A being premium free. If you have less than the 10 years that you've paid into the Medicare taxes, then you would have a 10% penalty if you applied for Part A
Right.
late. That doesn't apply for like anyone.
I've been doing this a long time. I think I've seen one in 34 years. So that's not real common at all. So the next one is, though, this is the one that we see all the time, right? In that example, if I'm 70 and I didn't enroll for Part B, then if I do enroll, oh, I'm sorry, you're talking about the special enrollment period, right?
So on Part B, if you're over 65 and you don't qualify for the special enrollment period,
Then,
or you didn't take advantage of that, then you would be.
then you're going to pay a fine. In that case, 5 years is 50%, right? So it's steep, but the government says that's your fault.
And then Part D, the prescription drug side, if you, within 63 days of picking up A and B, if you pick up a prescription drug plan, there's no penalty. After that, they tell you it's 1% of the current average national premium. It's about 33 cents a month.
Right.
But that would not apply if you don't ever pick up a prescription drug plan.
And again, that's a personal decision, Leslie. We tell everybody, make sure that's up to you. We only want to present, what's legal out there so people don't get fined. If you decide that's something that a Christian Scientist doesn't want to do, then that's totally up to you, right? But we're going to talk about what happens if they sell you one of those other plans, right? That's too good to be true kind of plans. Yeah, we probably had, at least 100 or so calls in the last in the month about those plans. Like, I signed up for this plan. Why am I getting this penalty all of a sudden? It's supposed to be free.
So that would be the second insurance option. That would be a Medicare Advantage plan because they include prescription drug coverage.
Right. That people don't know about. Joe Namath doesn't, well, I guess Joe tells you that
You
all
might pick on Joe.
because he's the one that's out there telling everybody, hey, these great plans are wonderful, they're free, you get all these extra benefits. What he doesn't tell you, right, is that you're going to be required to have pre-certification. You can't just choose to go anywhere. You've got to stay within a network, right? Most common ones are HMOs, health maintenance organizations. Katie's even got a picture of a card up here, or a PPO. Anything with a letter after its name, HMO, PPO, POS, anything like that, is a Medicare Advantage, otherwise a Part C plan. And they make them attractive. I mean, they advertise them all the time. They're the most profitable insurance product for an insurance company. So they have a lot of incentive for you to get on one of those plans, right? The government's paying them money for they're going to take care of you, and boy, do they take care of you. But I think John's even pointed out a few times that it's not, if I'm a Christian Scientist, I don't want to come into Ardenwood with an HMO type plan. I know that causes lots of issues, right, Leslie, in terms of billing and how you can be paid at Ardenwood.
We certainly have had several over the years pay, but there have been many that do not pay. They don't speak the same language as we do. And whereas original Medicare, there's no question. We determine that the individual is qualified. But when someone is in a Medicare Advantage plan, it is actually not Arden Wood Christian Science nurses that are making the determination of whether they're qualified for Medicare benefits. It is actually a medical personnel that is making that decision at the other end of a phone. We're having to make a case. And again, we don't diagnose, but we're having to show why that individual needs skilled care. And they don't always understand what we're trying to say without diagnosing.
Right. And we do get a lot of calls from clients in the Bay Area, in the San Francisco Bay Area, asking about how do I get out of that plan if I want to go to Arden Wood for a stay, for example. And now is the time to do that.
Just don't get into it. That's the first thing.
Well, here's
Get out when you can.
Really a big one. Because if I'm on a plan, and I'm not saying Humana, but if I'm on a plan and it's a zero premium plan, gee, that sounds pretty good. I can get that and go, well, just in case something happens, have an accident, I've got coverage. What they don't tell you is that a lot of these plans, like on this one, prescription drug coverage is automatically included. Now I'm going to go back to my call with that 70-year-old who says, if I've been on that plan for 5 years and I'm 70 and I've signed up for this plan, why am I getting a bill from the government saying you owe money, even though it's a zero premium plan, Katie?
And that's because if you, let's say at 70 is when you pick up the Medicare Advantage plan and you've had A and B for 5 years, then they're going to tell you that you owe 5 years of the penalty on that prescription drug plan because it's part of the Medicare Advantage plan. And
you go, well, it's I think it was 33 cents, something like that, and per month, but 5 years, that's 60 months times 33 cents. That adds up, and it's every month for the rest of your life, or as long as you're on that type of plan, right? But now is the time, if you decide, listen, that plan is not what I want. Somebody sold that to me. I really didn't buy it. I was sold something. I really didn't understand all the benefits. Now's the time that you can do something about that. And several calls, right, especially from the Bay Area, about I want to go to Arden Wood. Is that the type of plan I should have? And the answer is no. If your goal is to be able to receive care at Arden Wood, that's probably not in your best interest to have that type of plan.
So we talked about that general enrollment period. So if you don't have Part A and Part B, or you don't have Part B and you only have Part A, and you need to enroll in Part B, that happens between January 1st and March 31st. In addition,
right,
there's also what's referred to as the Medicare Advantage open enrollment period. And that is for individuals that are on a Medicare Advantage plan already. And it's same dates, January 1st through March 31st. So we're in the middle of that as well. So this is the time where you can say, I want to drop that Medicare Advantage plan. I don't want to be in it any longer. And if you have that Part D penalty,
it goes away. It's gone, right? If you don't want that anymore, you don't need it. That fine goes away also, which is a big deal, especially if you think you're paying zero and I've got to pay another $30 or $40 a month for a penalty. This is the time to do it. We've got till the end of March.
It allows you to go from a Medicare Advantage plan and return to original Medicare, that Part A and Part B. And then you can apply for a Medicare supplement plan if you wanted that insurance coverage.
Right.
You will have to answer health questions in order to get that Medicare supplement plan, but they will not make you do any sort of exam or visit a doctor. Then we would just ask the health questions of you over the phone.
Okay, and I've yet to have anybody answer yes. Okay, so most Christian Scientists are blessed with incredibly excellent health, and you do want to do it earlier rather than later if that's something you're thinking about, because sometimes in life, health does change as we age, right? We know sooner or later things happen, but you really want to do it when you're healthy and blessed with good health, and that the time would be now. So the process would be you'd want to talk to us first to determine if that's in your best interest. If you think that's a good thing for you to do.
Please don't go out and like cancel a plan.
Don't
Call
do
us
that.
and talk to us first.
Yes.
Let's go over, if that is the best for you before you just go.
Right. We want to make sure that's in your best interest too.
So what about long-term care?
What about long-term care? We get asked that all the time. What about long-term care?
So long-term care, again, is when you need help with those activities of daily living. So it's when you need care, you need help with healing. Most of the time, It's when you need the practical day-to-day care help. So you need help maybe getting out of a chair. You need help with eating or cooking a meal, something like that.
Right. The activities of daily living, they're called. And if you think about it in the morning when you get up, that's how I always think about it. It makes it easy, right? You get out of bed, they can't say get out of bed. They call it transfer. I got to transfer out of bed for having issues, or somebody, my son or grandson or somebody's standing by saying that you need some kind of assistance. That's transferring. And most people use the facilities, the bathroom next, and that would be another one with the practical side on that. Bathing, showering. As we age, people get less mobile usually, and sometimes that presents an issue too. So these are different. These are something that Medicare does not cover, and that's what we want to stress. This is something Medicare, it's not skilled care. It's not skilled care. It's custodial type care, like Katie says, with the practical side to life.
So a long-term care policy could be used if you have a Christian Science practitioner maybe not nearby, where you can still receive care over the phone, but you need someone to come in and help with those homemaker type things.
Right. That's true.
There are also policies that will let you use those long-term care benefits to also pay for a Christian Science nurse or practitioner as well. And we like those policies a lot, actually.
We like them a lot. And unfortunately, there's only a couple companies, one that's real Christian Science friendly right now, that helps us, that would pay you a cash benefit. And you decide how you want to spend that money, whether I want to spend it on a nurse practitioner, whether I want to have my grandson mow the lawn, my neighbor take me to an appointment, somebody go shopping for me. Those, after I trigger the benefits, right, I start receiving the monies from the insurance company, they send me a check. That's why those are called indemnity type plans, meaning it's a cash benefit. So let's say if I have that plan and my benefit's $7,000 a month, I'm going to get a check for $7,000. It's up to me to decide what I want to do with the money, not an insurance company dictating that I cannot go to Ardenwood because you're an accredited facility, right? Not licensed in the eyes of the state of California. So those plans are our favorite. But during this pandemic, we've had a lot of calls, especially from the Midwest. It seems like Idaho, Montana, Wyoming, a lot of calls, Missouri. People are living out kind of not in a populous area. And they're saying, we don't have anybody close by. And if we do need some type of extra care, what are we going to do? So, we look at everybody's situation is different. And sometimes it makes a lot of sense to go ahead and look at a policy. And sometimes it doesn't, right? It really depends. But I'll tell you this last line here, from talking to a number of Christian Scientists, a lot of adult children, they get pretty nervous as people age. They really want to know, do you have a plan? Does that plan include what if something does happen, something beyond spiritual care, and we need some other type of additional coverage? Who's going to pay for that, right? How is that going to be covered? So we address that too. We talk to a lot of people, and quite honestly, we tell some it's not for you, right? It may not be for you, but on the other hand, it is peace of mind knowing that if I do need it, I do need some type of extended care coverage at home, I can use that policy if I need to or want to.
Anything to add to that, Leslie? I know that was a lot.
I just wanted to clarify that third bullet point. I'm not sure I'm understanding it. Do you mean a Christian Science nurse?
You can use, so in that third bullet point, there are a few Christian Science friendly plans. So we use a company Nationwide. We've talked about Nationwide before. They have an asset-based care plan, right? Where it's like on a life insurance policy. But the nice thing is I'm going to receive a benefit from that. Whether if I pass away, my family's going to get a tax-free death benefit. And we've got, I think, a slide showing that. We'll show them. But the point being is when they send that benefit out, once I start, using that benefit, I qualify. I can't do 2 of the 6 activities of daily living. Instead of the insurance company saying I can only go to certain facilities or I have to have a licensed caregiver, they're going to send me a check, Leslie. So in this example, if I get a check for $7,000, I can say, gee, guess what? I can have a Christian Science nurse. I can use the monies to stay at Ardenwood. There are no restrictions. It's up to me.
You're not having to.
It could work like what our program that's like an assisted living program is called sheltered care. It could apply to that because it's light Christian Science nursing, not skilled care.
Right.
Or a visiting Christian Science nurse.
Right. Whatever you want to use the money for, there's no stipulation.
Right.
It's your money. That's why it's so Christian Science friendly. On the other hand, the traditional type policies that have been out there, and a lot of Christian Science I've talked to seem to have Mutual of Omaha, John Hancock, there's a lot of them. Those are reimbursements. And that means that's totally different, meaning that I could not use that policy, for example, at Ardenwood or Chestnut Hill or wherever I'm going.
Unless they had a Christian Science writer.
But a lot of people think they had Christian Science writers on those plans, and the ones they've sent us, unfortunately, a lot of them don't. So that if you do have a policy out there with a Christian Science writer, you should really get it out to review it and make sure that verbiage is in there. Doesn't matter what somebody told you, doesn't matter what's an illustration, it's what is in that contract. That's what makes or breaks the policy. If that writer's included, then you're in good shape with a Christian Science writer. If not, then you don't have it, unfortunately.
So it's really important just to bring up the topic of long-term care planning so people really start thinking about that. Because if you don't do any sort of planning, your automatic default is that you are going to self-fund.
Right.
And
Right.
if you're going to self-fund, you would have to decide from your nest egg what assets you're going to set aside or what assets you're going to use if you need care. The second option being Medi-Cal or Medicaid if you're not in California, because we have to be different.
Right.
And Medi-Cal or Medicaid planning is your second default if you don't have the money or if you've used your nest egg to pay for care. Or let's say I know there's a couple other options for them.
Yeah, I do want to mention that I don't believe any of our Christian Science facilities are participating in Medicaid anymore, which is based on a financial need. It's different than Medicare. So there used to be a few that were, but they're all out of it by now. So there is, many Christian Scientists may be aware of the National Fund for Christian Science Nursing. It's administered through the Principal Foundation. It's an amazing support. They will support, help an individual with the cost of Christian Science nursing care, whether it is in the home or in a facility. There's up to a certain daily amount that they will cover. So it may not cover all of it, but it may cover most of it or portion of it. So we're very grateful for that fund. We do have several patients at Ardenwood that have been able to use that funding. And I know many Christian Science nurses in the field are reimbursed in that way.
Good, thank you. And the last option is insurance. But quite honestly, if I say, okay, everybody raise your hand if you want to go buy a traditional long-term care policy, I'm going to guess of the hundreds on the call, no one's going to raise their hand and say, yeah, I want to buy one today, right? So, but there's a new way to do it. And that's what we don't want to spend a lot of time, but we talked about it before, using life insurance. These life insurance policies today, they're contractually guaranteed. Whatever monies you put in there, they can't charge you anymore. If they don't have rate increases, they can't do that. I'm going to show you just how these work. Right? You put money in with the insurance company. In this case, you can take $1, just add 0. So I don't want to say 100,000 or 10,000 or whatever the amount is. So you deposit it with an insurance company. You have to be approved for the policy, right? And then they're going to say, listen, we're going to give you an immediate death benefit of more than what you put in. So if somebody puts in 100,000, they're going to get a death benefit, normally higher. It depends on the state and the policies now as that's changing. But when it comes time to use the care, a lot of times we've seen coverage grow 3 to 4 or 5. I've seen 6 times the amount. So if somebody puts in $100,000 and when they need to use it in 20 years, that's now worth $600,000 for care. So it continues to grow. Right. Next arrow is going to show if you want to cancel some of the policies, you're always going to get back some type of value. So we call it your accumulation value. Some companies right now, after 6 years, you can get everything back. So it's kind of a safety net. If I don't like it, I can get all my money back. But those are changing rapidly. Insurance companies know that's a pretty good deal. So they're starting to change it where you don't get all of your money back in that time frame. Lastly, you're going to receive some type of a benefit. But if I live long enough and I pass away and I never use it, guess what? My heirs, my beneficiaries get a tax-free death benefit. It's not like the old days where you paid in that policy for 20 or 30 years and it's gone. So again, you got tax-free long-term care coverage if you need it. If you want to decide cash in, you can get most or all of your money back. And if you pass away and you never use it, your beneficiaries are going to get a tax-free death benefit, which is huge, tax-free. Or if you use some benefit, they're going to subtract that from the death benefit and you're going to get what's left. So I think that, I mean, I've been helping people with this since 1989 when they were called nursing home policies, Leslie, and nobody wants to buy a nursing home policy. Right?
Nobody wants to be in a nursing home.
Right?
No,
Yeah,
we're
nobody
not
does.
a nursing home.
So this, and it's funny because I tell people this is how you avoid staying out of a nursing home, right? You have, if you don't want to spend your money, I'm going to tell you that one. I know we're up on time here, but my dad passed away at 102. He was, my mom, ironically enough, had a long-term care policy. She passed away at 89, and she used it for just a brief bit, but she had one. My dad said, it's never going to happen to me. I don't care. And I've got the assets. Well, he had property. And it's so interesting that the one time in the San Jose Bay Area where my father was from, that the real estate market took a dip was in 2008. Okay. Guess when my father needed care, right? 102, he was 102. It was in 2008. So he had to sell a highly appreciated asset for much less than he would have gotten today. I mean, it was just, but that was his choice, right? He decided to self-fund. My sister wasn't thrilled with that, but that wasn't her money. She took a while for her to understand that. But that was my dad's, and it forced a sale that we really didn't want to do, but that was his idea. And that's okay. It was a plan. It's better than saying, I don't have a plan, now I don't know what to do, unfortunately.
So the important thing that you need to know about today is that you can call or email Jim or myself if you need any help, that there's not a charge to work with us, that the insurance companies pay us to help you. We will not charge you at all. And you can always go to our website, whatsmedicare.com, to get information. And then briefly, our contact information. And I know that Eddie's going to put that up at the end of the slideshow as well, too.
Right. And we're really good about getting back. We try to. Emails are great. You can call us. But I know we're going to get a lot of calls because we're kind of up against a deadline. So anytime you call, we try to get back same day, depending if I can't return 50 voicemails. Sometimes that's pretty difficult. But normally in the next day, we get back to you as quickly as we can because we want to make sure that we're really helping you. And it's a big decision, right? Do I add Part B? Do I do a supplement? Should I drop that other kind of coverage? What should I do? And that's important for you to actually just take a little bit of time and think about it and pray about it and decide if that's to go forward. That's it. I ran out of gas.
Great.
Okay.
Very well, Katie, we've got plenty of questions here. So
Good.
can we just dive into the questions? That was very
Sure,
helpful.
absolutely.
Perfect. Okay. First up, I'll be leaving my work in a month and losing my insurance. At age 65, I registered for Medicare Part A. What do I need to do now?
The easiest way to answer that, first thing you want to call us because we're going to tell you what you're going to need to do to add Part B, right? And since he's already 65 and past his initial enrollment period, he or she passed their 65th birthday. Thank you, Katie. That they're going to show them how to add Part B so there is no penalty. There's a form that Social Security requires. And why Social Security, John? Because they handle the enrollments for Medicare. That's the confusing part, right? Why would I want to call Social Security to enroll for Medicare? Because they handle the enrollments. But that easiest way is to call us. We can walk you through it, send you the form you're going to need, and you're going to do that quickly too, for sure.
Perfect. Next up, I'm already signed up for Medicare. Can I change anything at this point?
No.
Well, if you're signed up for A and B, then you're good.
Right.
But if you decided if you don't have a supplement and you want to add a supplement, that can be done now.
Anytime,
at this point,
right?
you've
Yeah,
done it at any point. You, depending on how long it's been that you've had Part A and Part B, you would have to answer those health questions if you wanted to do a supplement. So giving us a call would be a good way. We can tell you what the plan would cost so that you can make that decision whether that would be appropriate for
Right.
you or not.
But this is the time to change your Medicare supplement. So if I had a Medicare supplement plan for 5 years with company ABC and I want to look at moving to XYZ, you can really do that anytime. This is not the time frame
Yeah,
that. Right.
we're not
Yeah.
up against a deadline on that.
right on that.
Great. Next up, if I had only A for a number of years, can I still get B affordably, or is it very costly? Is it worth it or necessary? I was told by someone in the Social Security office that I would have to pay back premiums at this time. Back premiums at this time. What is the alternative?
Okay, so the alternative is to talk to somebody else because I've never heard of back premiums. Right, normally,
I
so
never
if
have
I,
either.
let's use an example, I'm 68, okay, so we know that I should have signed up at 65 and didn't. So that's 3 12-year periods. So like Katie said, that's going to be 30% more I'm going to pay in addition to, but I haven't had Part B coverage. So if I did sign up, right, I go down, I sign up, and I say I'm going to start at April 1st. Well, that's when my premiums for Part B would start, including that 30% penalty. But I've never heard of a back pay for 3. I think you need to quit listening to your brother-in-law, your neighbor, and your coworkers.
Well, in
because
that case, it was Social Security.
Oh, Social Security, yes, maybe them too. I don't know.
Supposed to know.
But John, I've never heard that one. So, man, unless that's, I don't know.
The only thing I'm wondering is the Social Security person getting Part A starting retroactively or something?
I don't
Like the
know.
benefit? I don't know.
But there is
I
no
don't know.
retroactive. You're
No.
just going to pay going forward. You're not going to pay
Right.
those last 3 years.
Exactly. This is asked, but I think it's worth asking again, or answered rather, and asking again. What is the average length of stay in a rinky, Leslie?
It's very
Or
individual.
time limit, I should say, time limit.
The
excuse
time
me.
limit, the Medicare, if someone continues to require skilled care, the first 60 days have that $1,600 deductible. Then from day 61 to 90, it's what, 300 this year?
400 a day.
400 this year.
400. Okay, they change it every year, so keep
They
it up.
do.
And then after that is a lifetime reserve. So if you go through all of that, then beyond that, it becomes private pay. If you do not have insurance, if you do have a Medicare supplemental, it will pick up all of those deductibles, and usually up to about a year, you will have full coverage.
Right. That's
So
exactly.
there is no average length of stay for. Generally, it's a very individual. I mean, we have individuals come in and out in a few days, and we have others that stay longer. So
Exactly. Thank you. Would you please repeat the caveat of healing and then not eligible for further coverage? Because that relates to.
that if someone is
I think they're asking on the qualification for Medicare to cover them in a ring.
Right.
okay.
Exactly. Good
So
job.
when we say skilled care, it's care that is requiring a skilled Christian Science nurse to care for. So it's not long-term care, lighter care that a family member could be giving. Often it might be involving wound care. It might be involving maybe after the effects of a fall or someone presented with a sudden need, where they would normally be going to a hospital. They're choosing to come to a Rinky to receive Christian Science nursing care. It's that level of care that is eligible. And we make that determination about eligibility based on the need for skilled care. So as things improve, that's where we might occasionally make the decision they need to go off of it before this full 60-day period. So
Exactly.
is that
Great.
helpful? There's
Next.
still are other Christian Science. There's a lighter level of care that we can provide. It's just not covered by Medicare.
Exactly. Next up, how many of the current Christian Science care facilities are Rinkies?
I think it's 10. Is it, John? Does that sound right?
I think it might be 9.
Nine,
actually.
might be 9. Yeah.
So-
Some
Actually, I'm just
facilities,
informed it's 8.
8.
There are 8.
Okay.
Some have gotten out of it because there are, costs associated with offering it in terms of back office, that type of work. It can be expensive to administer, but
And I think if a facility, maybe a smaller facility, may have very few individuals that use Medicare, it might
Right.
not be worth it for that reason. It is a benefit that most Christian scientists have because they've been working in the US. So I years ago, someone from the Mother Church Committee on Publication stated it's one of the most important accommodations we have because we are being recognized as giving legitimate skilled care. So it's wonderful to be able to take advantage of that, something that we've paid into as individuals. But how lovely that it can be used with our choice of care. And that's only with original Medicare. So
Exactly. Next up, is supplemental G through third-party providers only or through Social Security?
Yeah, it's through an insurance company, so it would be a third-party provider. The government doesn't do, they just do Medicare. So for example, like I purchased mine through AARP United Healthcare. I thought they had the best plan G that I liked. So that's who I got myself. So, but right, the government doesn't do insurance plans, supplemental plans.
How much this is the next question. How much does Plan G cost?
In my area, $127.52 a month, John. But that's only in my area, right? That's my monthly premium. It depends. If I'm in Carmichael, it may be $135. If I'm in San Francisco, it may be $135. It really depends on the region and the zip code you live in.
It
right,
also
Katie?
depends on, so while Plan G functions the same in 47 of 50 states, because 3
Right.
states have to be different. So Plan G works the same, but every state decides how they do the rates for that plan.
Right.
So in some states, it's the same rate whether you're 65 or 85. In some states, it's based on age. Most of them it's based on zip code. So to get an adequate number, you would have to give us a call,
Right.
because it's wildly different depending on where you live in the country.
Yeah, for example, California, Southern California is much more expensive than Northern California. So if I'm down in Los Angeles or San Diego or Mission Viejo area, I'm going to pay more for that same Plan G than I am if I live up in where I live in Lincoln, California, in Placer County.
Excellent. What Medicare parts should I sign up for, if any, when I turn 60? These are kind of repetitive, some of these. What Medicare plan should I sign up for, if any, when I turn 65 and am still covered by my husband's employee policy?
So if you are covered at 65 by a group plan, either yours or a spouse's group plan,
Mhm.
and they have 20 or more employees, again, 20 or more being that caveat, then you don't have to sign up for Medicare Part A or Part B at 65. And it wouldn't be until you're coming off that group plan, whether your spouse is retiring or loses the group plan, then at that point you would pick up Part A and Part B if you
Right.
decide to do so.
And the opposite, if it's under 20, if I'm a sole practitioner, if I work for Joe's Tire Shack and there's 10 employees there,
A small company like
small
ours.
company, then you must enroll for Medicare or you're going to pay a fine. So again, if that person's covered by their spouse plan, there's no need to enroll for parts A and B. They're protected because the group plan is the primary payer. That's why Medicare doesn't really want you to go on to Medicare. They'd rather you stay on that group health plan
Over 20.
over 20. Yep.
We've had a request to, thank you. We've had a request to post the contact information again. That will be at the end of this webinar. And we're going to go till 5:30. So it's now 5:08. So we've got about 20 more minutes.
Okay.
I've got a number of questions here. Next up, can you share the phone number again for Jim and Katie? That's again, sorry, I should have read that before I said it.
Just
We'll
lightning
be close at
round.
the
We'll
end.
just
Exactly. Remind us, please, what to do with an old Medicare card to bring it up to date. Good question.
Real simple. Call 1-800-Medicare. It's real simple. Call 1-800-Medicare and you want a Medicare replacement card. It's that easy. You can do it tonight. You can do it tomorrow, but you want to do that right away. 1-800-Medicare. I need a replacement card and they will send you one.
If you're a little bit more tech savvy, you can also go on to, if you have a myssa.gov account, you can go on there and you can request a replacement Medicare card. I had someone do it while I was on the phone with them earlier this week. So you
Right.
can do that too.
But you want to do that, John. They want to do that right away.
Perfect. Okay. Good information. But once again, this is recorded, so you can go back to this. Anything that you might have missed during this webinar, you can watch it again. Next up, I'm 62. Is it too early to start asking questions?
No, it's never too early, right? You want to educate yourself and know what's coming down the road. So we get a lot of people call us when they're 60, 62. One of the reasons why, John, is sometimes people, we talked about that. It's called an IRMA. It's an additional premium for higher earners. So sometimes you may want to shift assets earlier than 65, right? So you get that out of the way. So your tax return's not going to be higher when you finally, if you retire at 67 or 68. So there are reasons to do some advanced planning, actually.
That's actually a great idea. I would rather that than somebody call me and say, oh, I need Medicare like tomorrow.
Right.
Knowing it
Sure.
early doesn't hurt at all. It's a great
Exactly.
thing.
Exactly. Question, are you familiar with military retiree options regarding Medicare?
Yes, but that doesn't apply to everybody. So you can call us on that, whether it's a VA or TRICARE, right?
Yeah.
They can call us on that.
I will
Leslie,
mention that
yeah.
TRICARE for Life can be used at Ardenwood, it can be used at a Rinky.
Had great experience with that at Ardenwood. The TRICARE.
Right. And then,
Absolutely.
Leslie, with TRICARE, they have to have Part A and B of Medicare, right? That's normally
think
required
so.
for TRICARE. VA is different, but for TRICARE, they need A and B.
Next up, if qualified for Plan F, is that the better option than Plan G as in George?
That's a really good question. And it really depends. We have a lot of clients where if I tell you, gee, John, if you change from Plan F to G, you save $40 a month, almost $500 a year. And now that savings, you're only going to pay $226, right? You're ahead. And some people go, it's not worth the hassle. I love Plan F. I don't have to worry about anything. I don't want to worry about a deductible. So it's really an individual decision. Me, I'm a big believer, check it out. I mean, we've seen some people, we've saved like $600 saying, gee, that's a lot of money you're saving. And you're only out of $600. You only have to pay $226 this year. So you're almost $400 ahead, right?
That $226, that's that Part B deductible.
Yeah.
So for the medical side, if you don't use Part B, and a lot of Christian scientists don't on a year-to-year
right.
basis, then you wouldn't have to pay that $226
Exactly.
deductible.
Yeah.
So you would save that entire $600 difference
Yeah.
between the two premiums.
Right.
And that's the only difference between Plan F
And
and
Plan
Plan
G
G
is
is that Plan G doesn't cover the Part B deductible.
right.
Great. Can you tell us more about how to get Part G?
So Plan G is through insurance companies, and that's where we help.
Right.
So that's where we would be able to tell you what the price is. We would be able to help you sign up for that. And then what we ask is that if you call and we quote that you work with us, and then it's the same rate whether you go through us or the insurance company. The only
Right.
difference is you get us to call. So
Right.
we tell you that you call us instead of having to call the insurance company directly. And I would say, 99%
Yeah.
or more of questions we can answer without having to get the insurance company
Right.
involved.
And we've used this model. I've used it for 34 years, right? It works really well. But again, my wife doesn't let me work for free. So I'm happy to help out. But normally, if you're going to work with the insurance, if it goes through us, then we're compensated. So it works out well.
Mhm.
Great. I have Plan F. Can I now add a long-term care policy?
Again, that has nothing to do with your supplemental plan app. That would be a separate type policy. So the answer is yes, you can check it out. You can email us your information or whatever you want to do so we can look at that and see if that's a viable option for you or not. It really depends on your age too. If you're 88 or 89, and I get quite a few of those, that's not going to happen. But everybody's individualistic, and it really depends on your finances and your situation. And that's why I don't want to keep saying call us, so you can email us, but we'll let you know if that's.
Mhm.
Great. I've never heard of this one. Silver sneakers and dental and vision plans are only available through Advantage plans, correct? Are
No.
there supplemental plans that cover these items?
Yes. So
What are
for
silver
example,
sneakers? My goodness.
so this is, that's a great question.
We've never talked about this.
So I belong, I've got the AARP United Healthcare plan, which I really like. And you have to be a member, and it's really expensive. I think it costs me $16 a year, and it covers myself and my wife, right? You have to be a member. So John, I'm up here, and they have this, instead of silver sneakers, it's called Renew Active. And Renew Active is a program where they'll pay for your gym membership. So my wife is an avid tennis player. She plays nationals and all that stuff. As a matter of fact, she plays over in Carmichael quite a bit. So I looked at this club called Lifetime Fitness, and she's like, well, that would be a really good club to join. I go, well, that's $399 a month for two of us, and I don't play tennis, so I don't think I want to join and pay $200. So I get my United Healthcare card, AARP card, and I call him over there and say, yeah, I have supplemental plan G. And he goes, oh, you can get a free membership. I go, I need to talk to your manager. He goes, well, I am the manager. I'm the man. And he goes, your membership. And I go, are you serious? And the Renew Act is a really beautiful club. They have one here in Roseville and in Folsom area over there. And it's included. And they have a lot of the huge health clubs that are included. I've had a couple of people go, so you mean to say if I buy that, I go to that tennis club, that's a $2,400 a year benefit that I get for free. And I said, as long as you've got the supplemental plan. So Silver Sneakers is what some companies use. AARP uses a plan called Renew Active. And I really like it. And a lot of the plans do have, they may have dental discounts, right? Like the supplemental plan that I have has discounts that I can use for both vision and dental.
So I think what the person is referring to, so a lot of those Medicare Advantage, those lower cost plans will include dental and vision coverage. And the reason they do that is they do that as the enticement for you to come onto the plans.
Right.
With those dental plans, because the insurance company is trying to add them on relatively low cost, they go with dental HMO plans.
Right.
If your dentist is an established dentist, there is a very low chance that they take a dental HMO plan. Most dental HMO plans are like newer practices that are trying to build up a patient base, or you'll see like chain offices take HMO dental plans. But most people that are on a Medicare Advantage plan are not actually using the dental insurance coverage that comes with it, unfortunately.
That's really helpful. Next up, last year it seemed I shattered a bone and needed surgery. I had a difficult time getting the signature of a primary care physician, or PCP, which my insurance company required. Because as a Christian Scientist, I'd never been to a primary care physician assigned to me, and so I had been dropped after 1 year. Do all Medicare Advantage plans require to have a PCP? If so,
Yes.
how does one avoid an annual Medicare medical exam? It would have cost $17,000 had I had no Medicare. My husband worries that if I dropped Providence, we'd pay much more.
So the simple answer to that is yes, Medicare Advantage plans do require for you to have a primary care physician. And you will see that the primary care physician's office will require you to come in or drop you as a patient. And that's just due to the fact that they can't have a patient under them that they don't see, because it's a liability.
But
It's a
that's how the
liability
system
for them.
works. HMOs definitely require that. For example, contrasted with mine, I have original Medicare. I don't need that. I don't have to worry about picking a physician. I can go to any specialist I want to if the need ever arises. I can do that. I don't need pre-certification or pre-authorization. So if that individual had original Medicare, that would have never been an issue.
And isn't this the period of time that they could make that change?
This is exactly the time they can do that, Leslie. That's a good advertisement. Right?
Good job.
Do it
Leslie.
now. Exactly.
Do it now.
Between now and March 31st.
Right.
I am covered. If I am covered through my spouse's work, should I still sign up for Medicare at 65?
It depends. If the company has more than 20 employees, no, you don't need to. Less than 20 employees, then you must enroll for Medicare Parts A and B.
One
Right.
more caveat, maybe we throw out, is if you are covered, and we see this a lot of times, if you're covered under a spouse's plan, it may possibly be, what if your cost is $400 or $500 a month to be on the
Right.
group plan?
Yeah.
That may be an instance where you can always give us a call, shoot us an email, It may be where going on to
Right.
Medicare would be less expensive for you than being on the group plan. And you have the option to come off the group plan.
That's a great point. Up here in our area where John is tonight, we get a lot of teachers, right? They call us and say, well, my share of cost for my husband's $500 and he's 65. And we're like, wow, okay, you may want to look at another option where you can get original Medicare and a supplement and save, have better coverage and have a couple $100 savings a month. So
Mhm.
Katie's right. Yeah, that's
Great. And once again, we will show contact information at the end of this webinar. So that's the next question. Please repeat what letters RINKI stands for. It's a religious non-medical healthcare institution.
We
And so
didn't
that
choose
was
that term, Medicare did.
right. That's we're written into the law. So that was done by what Senator Kennedy and who was from Utah. You can see his
Orrin
face.
Hatch.
Was it
Senator
Hatch?
Orrin Hatch, exactly.
Mhm.
That sounds like a good trivia
That was
question.
the law in the early 90s, RNHCI or.
I'm writing that
religious
down
non-
for Jeopardy tonight.
There you go. There you go. What's the difference between Plan F or Plan G again?
It's real simple. Plan G, you're going to pay that $226 deductible this year for any outpatient service, emergency care. Plan F has no deductible. That's the only difference, right?
So I guess this
And
next
the
question,
premium, I should say, the premium
Yeah,
cost,
premium,
right? Yeah.
I guess the next question ties into it from a different person. I have Plan G, but I was born early enough to qualify for Plan F. Should I change it to back to F?
Probably no. I would say probably not.
Probably not for a couple of reasons.
Right.
One being Plan F is going to be more expensive. And the second option, if you want to go from G to Plan F, it is considered to be an upgrade and you would have to answer health questions to get Plan F.
But most of the time, quite honestly, it's not financially in your best interest to go from G to F, even if you're eligible for it.
Correct.
So that answers a couple of questions I see here. What are factors to use in choosing a company for supplemental plans?
That's a great question. So there's a lot of companies out there been around and I'm not comfortable with them. Even some, I want a big brand name company. That's, and this, I don't get, I'm not an advertisement or anything, but I like AARP United Healthcare. They have the largest block of business in the industry. I think they've got 4.5 million people or 4.4 million people on Medicare supplements. What does that mean to me as I'm a policyholder? That means larger numbers, right? Spreads the risk, means lower rate increases. They have the lowest rate increases in the industry. Some of these companies that have only been new to the marketplace or they're selling under another company's umbrella type plan, which means they haven't been around long enough, John, and the rate increases can be astronomical. I think the AARP United Healthcare plan is like, I think it's less than 4% over a period of time. So it's you want a big, strong company. It's brand name recognition. It's easy, right? If you live in California, you move to North Carolina, New Jersey, Idaho, any state, it goes with you. You don't have to worry about, oh, gee, we're not in that particular state. So that's my opinion. But from doing this for a long time, I realize one thing: as you age, clients they don't want hassles, right? We want life to be easy as we go. So you want to make sure you've got a plan, and don't ever buy cheap, right? Don't ever buy. There's plans out there that are cheap. If they're cheap today, they're going to be really expensive in the next few years.
The other thing is we always look for insurance companies that have a great record of paying claims.
Right.
Because the last thing that we want is for you to be doing your part in paying that premium each month, and then them to not do their part in paying the claims or fighting you when you
Right.
need the coverage.
Exactly.
And I know that United Healthcare has paid us very
Yes.
easily. I also want to point out that United Healthcare also has a Medicare Advantage plan.
Right.
Not to be
Yes.
confused. It's a different, it's not the supplemental plan, but it is also United Healthcare.
Right.
So
That's
be
exactly
clear,
right.
you want the AARP supplemental.
Supplemental plan. That's correct.
Mhm.
And we can help with that for sure. Yeah.
Exactly. Question: isn't it possible that a work group plan can be more expensive than Medicare Part A and B? In other words, isn't there sometimes a financial benefit to leave a group plan?
Yes, and I think Katie addressed that a few questions ago, right?
Right.
If I'm paying my share of costs, for example, for my dependents, say $500 a month, which is really common. I see that number a lot. It would be less expensive for that dependent to pick up Medicare A and B and do a supplemental plan. Much less expensive and better coverage, right?
Normally,
I don't need to worry about an HMO or PPO. I can go wherever I want with original Medicare. And if I have the supplement, I know my liability is capped at $226.
And
Right.
that's something where we talk to people every day that go, well, I'm still going to work. Do I need to do anything?
Right.
But here's what
Mhm.
my policy covers and here's what it costs. And we can always do a side-by-side comparison
Right.
and talk you through what it would cost on either option.
Yeah.
Yep.
Great. What does Plan G include? We've talked quite a bit about G. Is
Okay.
anything more? Is it anything more than A, B, or G needed?
Not if you're a Christian Scientist, normally that's kind of it. If you want to get a Part D
Right.
plan, that would be up to each individual, John. If I was talking to non-Christian Scientists, I'd say you need to get that or the government will fine you. But with Christian Scientists, God's blessed you with incredible health. And a lot of you are never going to need prescription drug coverage. So that's a personal decision for Christian Scientists.
Right. Would you repeat how long the SEP lasts after terminating employment-based group coverage? I retired at the beginning of the year and I'm 66, but I'm not yet enrolled in Part B.
So to enroll in Part B, you have 8 months
Right.
after that group plan ends. Sooner is better because if something were to happen today,
Right.
you wouldn't obviously have Part B in place. And the second thing being, when you are picking up, and I don't know that we've talked about this, when you're picking up Part B and you are over 65, and in this case, you're 66 and you've been on a group plan, there's a form that you need your former employer to fill out saying that you were covered by that group plan so that Social Security knows you don't have to pay that penalty. In this
Right.
case, it would be a 10% penalty. So the longer you wait, the harder it may be to track someone down from your old company to get that form to be completed.
Good point.
Great point. This was asked previously, but I think it's worth asking again. Are there any options to cover dental and vision through Medicare supplements?
Normally supplemental plans have discounts like the AARP. You can get a big discount for their United Healthcare dental options. Normally, we just recommend purchasing your own. You always want to make sure your dentist is on that plan, right? And that accepts that insurance as a provider. So a lot of times that's just easier to do. Don't be swayed by a lot of those Medicare Advantage plans out there saying, oh, you get all this great dental and vision and hearing and lift rides to the doctor and stuff. And knowing that as a Christian Scientist, it sounds good, but that's probably not in your best interest.
Exactly. Yeah, we call them disadvantage plans.
There you go, John. Say that again, John. That was a disadvantage.
Would there be a reason to switch my current Plan G to Plan F? I was born in 1953. I think we've asked that, but let's quickly handle
Asked
that.
and answered.
Asked and answered. What are your phone numbers? Asked and answered. That'll be at the end of this. We're coming to the end here. To self-fund would be, let's see, to self-fund would be the, I guess they're asking, how much money would you have to self-fund? What is the self-fund size needed?
Oh, they're probably,
long-term
are you
care.
talking about long-term care? Well,
I guess
I would think that's what it's referring to, self-funding
Mhm, I guess so.
for that. So,
I think that question may be better to give us a call because there's
Yeah.
some,
That's really,
Yeah.
it's
Yeah.
difficult.
okay.
Medicare A and B, if I choose to live at a retirement setting at one Christian Science facility, what kind of additional insurance should I have to reside at a Christian Science facility? Does insurance pay for any of it?
It wouldn't pay for independent living.
Right.
It might pay for assisted
Sheltered
living,
care. Mhm.
sheltered care. And if there were a need, if you were to have a fall or, have a challenge temporarily, Medicare would pay for the skilled care.
Yes.
Yeah, long-term care, that's where you talk to Jim and Katie. It gets tricky. what would the premiums be as a resident at a Christian Science organization?
For what level of care? That's the,
Yeah,
I mean, it is,
the question's a bit vague, yeah.
yeah, it's very vague. And it will
Maybe a
vary.
good question to call Leslie
Yeah.
with.
I mean, if you
Yeah.
want to know what they are at Ardenwood, I mean, they will be different in different Christian Science organizations. They will depends on the type of care one's requiring, if it's
Exactly.
light care versus skilled care versus independent. So that's hard to answer. But I will say that healthcare expenses, if one needs Christian Science nursing care or medical care, it is more expensive than most Christian Scientists realize, because they have not grown up going to the doctor and realizing how incredibly expensive these things can be. So you do want to be prepared one way or the other, either with insurance or self-funding, and not be caught off guard, because a very simple incident can literally cost tens of thousands of dollars.
Exactly. And that's exactly why we offer these webinars.
Mm-hmm.
My goodness, it pays to be prepared, and it pays to know the facts. And that's why we offer these webinars. It's incredibly costly.
And we see that
it's-
really common, Leslie, like you said, not knowing the cost, especially when we talk to a lot of Christian Scientists that don't have Part B and have not realized up until this point what that could mean as far as costs and how much an ambulance ride or an emergency room visit, even for a limited stay, can cost, and have realized that maybe not having Part B was something that they should have done, but they just didn't know
Right.
before.
No one
Yeah.
expects they're going to need it. No one. So,
Yeah.
but to
It's a
have
short
that.
ambulance ride is thousands of dollars.
Mhm.
I mean, every time you see an ambulance, look at them differently. They are
Right.
not free. They are not free.
And often it's
Take it
because
from
someone
me.
else has called it. Not that you've
Yep.
called it, but someone else has called it, and you're the one that gets the bill.
Right.
And they
911 is not
expect
free.
payment.
Mhm.
They do,
They
John.
expect payment. What insurance is
More-
best when?
Oh, go ahead.
Yeah, no, people don't understand the costs involved here. That's, again, you've got to be prepared. And that's why call Jim and Katie, read this stuff. It's important. It's important for you and your family and loved ones. What insurance is best when going to a Christian Science care facility beyond Medicare? Well,
We talked about that,
really-
like
yeah.
nationwide policy, and it really depends. I've seen it's so individualistic. It's kind of like a Christian Scientist. Every policy is different. I have some people that buy a reimbursement one because they want to have something, right? So again, that's individualistic. You can email us.
A lot of times
Yes.
when people are, what does care cost? It's kind of like the equivalent of asking, what does a car cost?
Right.
Because
Right.
it's so across the board as far as what you're buying and what you're looking for. And the same thing with
Right.
long-term care for sure.
Okay, we've still got more questions. We've gone past our 5:30. I'm going to notice what the last question is for now, and we'll just go up to these. Okay, I see this one. This is the last one I'm going to choose. Well, I've got a few more, but I'm not going to go beyond this one. I'm 70 and still working, small nonprofit under 20 employees, which does offer group medical, which I'm covered. I'm signed up for Medicare Part A, but at the time did not sign up for Part B. It sounds like I should now sign up for Part B during this open enrollment period, but it also sounds like I probably get hit with a major penalty, correct? And do I
Yes.
understand that I would then pay that higher rate for the rest of my life?
Yes, that's correct.
Yeah.
And the reason why it's that you should have done that when you were 65. I mean, there was nobody telling you that. And quite honestly, I've had 2 claims in the last, or not that we did, but I got called into 2 accounts to look at. And one was embarrassed because they were an HR manager and they had Part A, didn't have Part B, and they had their group coverage. And guess what? They had an outpatient surgery, John, and Medicare, there was no Part B coverage. So the insurance company said, well, you know what? We don't have to cover. We don't have to pay that claim because Medicare was supposed to be primary. So therefore, we're denying the claim. And insurance companies are great. Oh, yeah, we'll cover that. Yeah, don't worry about it. Well, listen, if I don't have that in writing and it's not part of the contract, I don't trust that. I want something that's a fact. And so unfortunately, you would have to pay a penalty, but you should have had Part A and B, right, when you were 65. So unfortunately, that's just the way it is.
Right.
Right.
Because like Jim said, having that insurance, that group plan now, if you have something that would have been covered by Medicare Part B, like the surgery
Right.
or an ambulance ride or
Yeah.
an emergency room visit, the insurance company can come back and tell you that they won't pay any of it because in that case, Medicare is primary and you should have been enrolled in Medicare and you're not.
Right. And,
Not to scare you, but that's just the reality of things.
and you know what upsets me too is they go, well, we'll pay, we may pay. I go, what does may pay mean?
Yeah, I'm not
You-
taking that to the bank.
Oh, yeah, yeah, right. You'd be going to the bank if you would, right? No, you need to do that, unfortunately. So
Yeah.
And sooner rather than later, because if they wait longer,
Yes.
it's a bigger penalty, right?
that's exactly right, Leslie.
In that
50% is
case,
better than
too,
60. Yeah.
That would be considered a general enrollment period enrollment. And the deadline for 2023 is March 31st of
Right.
this year.
Right.
So
They have
this
time.
month.
Okay, just a couple more here. We've gone over some of these. When you say original Medicare, you are referring to Medicare A and B?
Yes.
Correct.
Yeah,
Yep,
right.
that red, white, and blue card. Yep.
Oh, here's a good question. Should I always carry my Medicare card with me in my purse or a photocopy? That's a good
Yes.
question.
Yes. Yes.
We certainly found that to be true.
Done.
The age requirement
Right
for
around
plan, the age requirement for Plan F, that was 1953, I believe.
19. If you were born in 1954 or earlier, then you qualify for Plan F still.
Right on.
Right.
We're coming to the end. Let's see. What is the definition of a sheltered care? Oh, sheltered care, please. That is basically, go ahead, Leslie.
It's like assisted living.
Yeah.
Assisted living is technically a medical classification. We're not licensed as an assisted living, but it is light care, light assistance, maybe helping with mobility, helping someone up out of a chair, walking, helping with bathing, serving meals, not skilled care.
This is a really important one. We got two left here, but this is really important. If you use medical care for, say, getting an X-ray or a wheelchair, does that disqualify you from Medicare reimbursement at a Rinky?
This is a long story.
And it's really important.
It's really important. When someone is admitted to a Rinky, they're required to elect to use their Medicare benefits in a Rinky. That election form will be, what word am I looking for?
On record,
Disenrollment?
maybe.
No, it's not disenrollment. I just totally
right,
went blank.
I did,
Revoked, a revocation.
Revocation,
Sorry.
exactly.
It becomes, if you then use your Medicare benefit for anything medical, it will revoke your choice to use Christian Science care. So you're allowed to do that once without penalty. The second time, you will not be able to use your Medicare benefits in a Rinky for 1 year. And if you do it again, you can't use the benefit in a Rinky for 5 years. So
Yeah.
you don't want to go back and forth. It's designed to basically say your choice of care is Christian Science. So this is, we run into a little challenge sometimes if someone does go for an X-ray after they've been in a facility, so they will get that one revocation. We really discourage any follow-up visits if they need to go back, because, or if there's any way they can pay out of pocket for those. So they will still be able to use that benefit back in the Rinky where they might stay a little longer.
Yeah.
Leslie, does that matter if the medical coverage is used prior to staying in a Rinky? Does that change things at all?
Correct. You're absolutely right. So if someone has had a fall and they're thinking, do I get an X-ray or not? It's better to go get the X-ray first and then come to the Christian Science facility, be admitted, do the election form for in a Rinky. Then you're clear. It does not affect it if it's done prior.
Right. It's tricky.
very
Again, they don't want
tricky.
you to go back and forth.
Mhm.
That's how the law
However,
reads.
the benefit will always work in the medical. There's no penalty there, but there is a penalty if you go back and forth. So you may lose the privilege of using your benefit within a Rinky for a period of time, but you will still be able to use your Medicare in a hospital setting, just not here.
Last question. I've seen that there's two more after, but they've already been, if people want to watch the video again, they've been asked and answered. I've had a serving Christian Scientists policy for many years. Would it be good to get Plan G?
I'll just speak to that first. The SCS policy, you can't get them anymore.
Right.
They usually pay a fairly low amount, a daily rate. You could keep that and get a Medicare supplemental that would be more generous in its coverage.
Great. Well, that's the last question. So grateful. Thank you, Jim, Katie, and Leslie. This was so clear and helpful. It always is. Please don't hesitate to call any of these three individuals with Medicare or insurance-related questions at any time. They are happy to help. One other resource that you are welcome to contact is the Christian Science Provider Network. Once again, the Christian Science Provider Network. You can look that up on your search engine, which works directly with Medicare and insurance companies on behalf of Christian Science care facilities, as well as individual Christian scientists. Another resource for financial assistance available to all Christian scientists and all ages is the National Fund for Christian Science Nursing, or the NFCSN. The contact information for these resources is listed at the end of today's webinar. Again, the point is that it's wise to be thinking through your options now. Plan ahead. And before we go, I want to thank you to attend, or invite you to attend our annual meeting, our Ardenwood annual meeting, which will be on Sunday, May 7th, always the first Sunday in May, at 2 p.m. Pacific. You'll receive an email invitation with more details. You can register at all our online events on our website, ardenwood.org. Gosh, thank you all once again for joining us today. We look forward to you joining us again at another meeting, and goodbye for now.
Thank you.
Bye, everybody.
Bye.